health stories, and out-of-pocket. The following stories were collected from a community of immigrants and illustrate the complexity of health systems in Australia. These examples include routine procedures, usually a day surgery or 1 or 2 days in hospital. Thankfully, our community has many healthy young people, but you don't know when something is diagnosed and you need to act quickly before your condition deteriorates. A general advice is, if you have a medical condition and need hospital services, check with your insurance provider first what costs are covered and what not. If you are on a PR visa, call Medicare as well, besides your private health insurance, if you have a cover. They can help you estimate the out-of-pocket expenses. Even routine procedures could cost you several thousands of dollars. Manu and routine surgery. Manu, 35, is working as a plumber. He is on a work sponsorship visa, which has a mandatory health cover requirement that he pays for every month. He has private health insurance, top working visa cover. One day he felt some heavy pain in her abdomen when he was lifting metal pipes. His wife urged him to get it checked. First, he visited his GP, who sent him to get an ultrasound. The ultrasound results showed hernia, and his GP gave him a referral to a specialist who can decide what to do next. After meeting with the specialist, he was advised that he needed a routine surgery to avoid further complications and to eliminate the pain. His specialist was a surgeon, and he was operating in both public and private hospitals. As Manu is not a citizen and does not have a PR visa, the only way to get this done was through the private health system. His specialist explained that he would need to spend 1 night in hospital after the surgery. If no complications happen, he can go home the day after the surgery. His surgeon was working in St. Vincent Private Hospital in Sydney on Mondays and Wednesdays. Manu could choose what was the best date and day for him to have the procedure. They agreed on the date and time. Next Monday, he went to the hospital. The surgery went well, and his wife could take him home on Tuesday. After about 2 weeks, he needed to have another consultation with the surgeon to check if everything was okay. Thankfully, everything went really well, and he has not had any problems since then. In summary, he had 1 GP visit, 1 ultrasound scan, 1 specialist consultation before the surgery, and 1 specialist consultation after the surgery. 4 visits in total, plus 1 night in hospital. You can see the cost breakdown here. Although Manu had the top private health insurance cover for his visa, not all costs was covered by the insurer. His annual cost for private health insurance, including the cover for himself and his wife, was $5,285.60. Plus, he paid $2,827.60 for this procedure. Useful tip: because you are on a sponsorship visa, you are not eligible for Medicare. However, your employer takes 2% of your salary every month to contribute to Medicare. You can get this money back from the tax office at the end of the year when you lodge your tax report. Example, if you are on a salary of $60,000, this is $1,200 every year you can get back. Chloe's colonoscopy procedure. Chloe, 29, is single and was studying for her MBA degree in Australia. She had overseas student hospital cover, the essentials, basic level. This cover cost her $580 per year. One day she noticed some blood in her stool, and for a couple of weeks She had had abdominal pain. She thought it would be better to get this checked, and she visited her GP. Her GP recommended to do a bowel screening test. Unfortunately, her test results were positive, and her doctor recommended a colonoscopy in a private hospital. She booked in the day procedure, and the specialist removed 5 polyps from her bowel to prevent formation of bowel cancer. She could leave the hospital the same day in the afternoon. She has been perfectly well since the procedure. In summary, she had 1 GP visit, 1 bowel test, and 1 day surgery. You can see the cost breakdown in the following table. She had to fork out $522.60 for this procedure on top of the private health insurance costs, which was $580 per year. Useful tip: if you are a student from countries with reciprocal health agreements, as listed earlier, you can enroll in Medicare as well. You still need to take overseas student health cover insurance, but on certain procedures and GP visits, you can save money. Under Medicare, the above procedure can be done free of charge in the public system. Aunt Charlie and the flu. Aunt Charlie, 36, is a mechanical engineer and arrived in Australia on a PR visa. Because she's on a PR visa, she's automatically enrolled in Medicare, the government-funded health system. Every month, 2% of her salary is deducted to contribute towards Medicare as a tax. She also has private health insurance, basic hospital cover, which cost her $1,040 per year. One year, in winter, she caught the flu and was really sick. She could not even get out of bed. She had high fever and all the nasty symptoms of the flu. Because Australia, in the middle of the pandemic, she was not allowed to visit her chosen GP. She could do, however, a telehealth consultation with her. Her GP prescribed some medication and recommended to stay at home and rest. After 10 days, she got better and could start working again. In summary, she had 1 telehealth consultation and ordered medication online using the electronic prescription her GP had written. Cost breakdown. Medicare covers telehealth consultation and medication. They pay a predefined fee towards these services. Her private health insurance does not cover this medical condition, the flu. Because she had a chosen GP and she did not use bulk billing clinics tele option, she had some out-of-pocket costs for the consultation. Even if you are covered by the government-funded model, Medicare, you may still have out-of-pocket costs for certain services. Useful tip: if you do not insist on selecting your own GP, it is best to use a bulk billing medical center. You will be treated by the first available clinician. However, you will not have out-of-pocket expenses for consultation. The only cost you have is the medicine that is prescribed for you. You can use bulk billing clinics for any illness and symptoms, and the doctor there will refer you to a specialist if you need further consultations. Summary: it is essential to understand what fees you need to pay if you are sick. Funding is very complex, and the private insurers have their own costing systems. Both public and private healthcare services are of high quality. No matter what visa type you have, you will need health insurance cover. With permanent residency, Medicare is enough. For other visas, private cover is mandatory. Have at least basic hospital cover. It is more important, while extras are optional. Healthcare is not free in Australia. You can optimize your costs if you navigate well in the system. Use bulk billing clinics. Focus on staying healthy. This is the best for all stakeholders, for yourself, and for the government. The health stories illustrate the nuances of the system here. Unless it is an emergency, before going to hospital, I recommend that you call Medicare and your private health insurers to inquire about the estimated costs and out-of-pocket expenses. As you can see, healthcare is a complex topic, and there are many rules for different visa holders. Check out the infographics that you can download. It is added to this chapter. It summarizes all the key points by visa types. Let me tell you another personal story. My first encounter with the Australian healthcare system was an emergency. 3 weeks after our arrival, I was bitten by a caterpillar. My arm got so swollen that we had to run to the emergency in a nearby hospital on a Saturday morning. The queue was long, mostly young and fit surfers in wetsuits with all sorts of injuries. When the nurse quickly looked at me, she advised to go over to the medical center nearby if I wanted to avoid the 3 hours wait in the emergency. We walked over to the other clinic, and the very experienced doctor checked my arm. She said that she had never seen this bite before. I'm glad I could contribute to the further development of the medical science in Australia as a very rare case study of caterpillar bites. I received medication, and after about 2 days, I was back to normal. The moral of the story: you never know when you need healthcare, so better be informed. This was our last chapter. Thank you for watching. Check out the website nestinsider.com, where you can find the latest news, updates, Australian stories, and don't forget to sign up. We genuinely hope that the insider information will help you make a better decision for yourself. Good luck. Have a good one.